Thank you so much. Good afternoon, everyone.
മരുന്നുണ്ടല്ലോ. ആരെങ്കിലും മീറ്റിംഗ് ചാറ്റ് ലിങ്ക് ഉണ്ടല്ലേ? ടോപ്പിക്ക് ഇന്ന് ഫുൾ ഓപ്പൺ ചെയ്തേ. നീ കൂടെ അയക്കാം. ഇപ്പൊ നിനക്ക് അയച്ചിട്ടുണ്ട് നോക്ക്. നിന്റെ ഒന്ന് ഓപ്പൺ ചെയ്. നിന്റെ വാട്സപ്പ്.
Okay, sir.
Too much. It's enough. People know, and we'll start the session. Okay. Thank you.
Okay, sir. On the behalf of Department of Panchakarma, we welcome you, sir. Over to you, sir.
Yes, yes. Thank you. Thank you. So, will you be sharing my slide and you will be changing?
And change the slides, please. Sir, we will change the slides, sir.
All right. All right. Okay.
Okay.
So, ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಚೆನ್ನಾಗಿದ್ದೀರಾ? ಎಲ್ಲರೂ ಚೆನ್ನಾಗಿದ್ದೀರಾ? It's always my privilege and it's always my you know happiness. I'm always happy to talk or share my knowledge in in and around Karnataka, because almost like 6 years I spent my life in Karnataka. So Karnataka and Kannada is very close to my heart, especially North Karnataka. The correct freaks, Santosh Edali sir, Pugar sir, then Kendadamat sir, all my friends, whomever is there around Karnataka in various colleges. They always, support me. They always love me, and whatever I need to participate and share my views. So 6 months back, I was in Bella. I came, even especially Rajesh Kursar also. I personally thank him. So I thank the entire team of Panchakarma department for inviting me to share my little knowledge, whatever I have. So hopefully today's session, whatever I'm trying to cover, whatever I try to say, hopefully some kind of insights you all get, all the students and everyone. So this time, the topic, Santosh sir called me and told a little bit more different challenges and practical aspects and everything. So since 2-3 days, they have been asking the PPT, but let me be very frank with you. I could able to finish the PPT around 140 or 145 only, because I added certain different aspects to that. So hopefully everyone get benefited. Hopefully everyone enjoy my session. So once again, I thank the organizer, and I wish Tarnath College, because you are celebrating your wish all the best, and hope this college serve as long as the human race survives. Okay, I wish all the success to the entire college and the entire staff there. Thank you. Presentation. Hello. Hello.
Wait for a few minutes. We will share the screen, sir.
Recording in progress. Sir, you can start.
My voice is clear, right? Hello.
We are
Yes,
able
it's clear.
to hear you.
Yeah, from your side it is not clear, but my voice is clear, right?
Yes, sir, it is clear.
Okay, thank you.
Yes, sir, it's clear.
ഡെസ്ക്ടോപ്പിൽ അത് ഉണ്ടോ? ഇവിടെ നിന്നില്ലെങ്കിൽ ഷെയർ ചെയ്യും. ഡെസ്ക്ടോപ്പ് ഉണ്ടോ? ഇവിടെ എന്താ പ്രശ്നം? ഇതിന്റെ എനിക്ക് കുറച്ചുകൂടി
share screen. Share screen. Yes.
കർസർ ഒടുക്കി. So I'm only sharing my screen. Is that okay?
Yes, okay.
Yeah. So we'll start it, right?
Yes.
Thank you. So the topic is concept of Abhyantara Sneha, classical principle and modern challenges. So basically, we'll see about the concept of Abhyantara Sneha and its clinical principles and basically what are the modern challenges and some of the clinical where I use different forms of therapy, that also Snehana therapy. We'll see that. Okay. So basically, what is Snehana, because see, when we though directly we can quit, but the thing is, whenever we need to talk about where it is. Is it visible? Is it visible?
Yes, sir.
I'm not able to see. Yeah.
Recording stopped.
Yeah. So basically, so we should have some introduction, the body and other things. So just though you all know certain kinds of small things, I would like to talk. So basically, what is this Abhyantara Snehapana? Basically, the use of medicated oils either internally called Abhyantara Snehapana. If it is used externally, it is Snehana. So the word Snehana, basically, it is both Bahya and Abhyantara, whereas Snehapana refers to administration of medicated fats Sneha Sweda also, Snehana is very important because it does dosha Shamana, dosha Shodhana, as well as dosha Brahmana. And after that, only you get with Vasti and Nasyam, you get this. So this sits very important place. It is a very, very important treatment modality because it acts as a Purva Karma also. It can act as a Pradhana Karma also. It acts as a Paschat Karma also. Okay, so as a Shodhana Sneha, it acts as a Purva Karma before Shodhana procedure. As a Shamana Sneha, it acts as a Pradhana Karma in elevating acute diseases as a Shamana Sneha. Okay, and as a Paschat Karma, it provides, so Brahmana also. So that is the reason why it can be Purva Karma, it can be used as Pradhana Karma, it can be used as Paschat Karma also. Okay, so basically that is the reason why it is always preceded to the rest of the chapter related to Panchakarma. Sneha precedes the rest of the chapter, and all the Sneha, Saro, Ayam, Purusha, importance of Snehana. So the entire thing, without that Sneha, nothing is, happens in this world. Snehanam, Bandhanam, that. Okay. So all the things are held together by Sneha only. So, and even in day-to-day life, without love and affection, okay, nothing happens. That's why we call it as Snigdha, or that's why we call it as lovable mother, lovable friend, lovable wife, lover, everything. So that is the reason why this particular word is very, very important. And Snehasaro Ayam Purusha, everything is made out of Snehana, and all the growth happens everywhere. If there is a growth, there should be the Sneha Dravya, Sneha should be there. Okay. Then now we will see one by one what are all the different things which is there in basically in Abhyantara Snehana. Okay. So what are the things as Abhyantara Snehana? Okay. So basically Achapana. Okay. Before that Rishyasi Matra, we start with Rishyasi Matra. Then Achapana you have, that is comes under Abhyantara Snehapana. Then you have Shamana Abhyantara Snehapana, Shodhana Abhyantara Snehapana, Brahmana Abhyantara Snehapana. Then you have Avapidana Snehapana. Then you have Uttarabhaktika Snehapana. Okay. Then you have all these things Snehapana only. So all these things where though different, these are all different ideas, different methods being told, the basic dravya is Sneha Dravya. So in these procedures, in these different Sneha procedures, okay, you use, different methods, though you use different methods, at the base, what you use is Sneha Dravya. That's why this Abhyantara Snehana includes all these. Okay, not only Shamananga, Shodhananga, Brahmananga, okay, that depends on its action. Okay, whereas all others also, starting from the Uttarabhaktikam, Avapidakam, okay, everything comes under Abhyantara Snehapana only. So little by little, not too much, little by little, we will go about, this thing just to refresh. Okay, so first one is Rishyasi Matra. You know that it is a test dose. Okay, here one thing very simple. What is the criteria for Rishyasi Matra? The dose which is digested in one yama. Okay, so this is the criteria. It should digest in one yama. It should not go beyond that. So whenever you are planning for test dose, you must give a test dose in such a manner it should digest in one yama. That is around 3 hours. So that should be the test dose. Whereas Dalhana is little bit more clarified this, and he says the dose is 1 phalam. So the test dose, you give 50 ml. He says when you give 50 ml, it will take 3 hours to digest. Okay, this is the dose wise. In many places they say, in our classics they have not told about the dose, fixed dose they have told. Many people say, but this is the one point where you see the dose is told by our Brahatris, Acharyas. Dalhana especially, he tells about this sloka particularly, okay, that test dose, whereas for everyday dose, nobody tells except Vangasana later, Kalyanaka Karaka told this, whereas he tells about the test dose. With this only we have to understand. So the exact in the numerical value, Dalhanacharya explained this. It is around 1 pala. But great, practically what we do, around 25 ml or 30 ml we give. Okay, because some, nowadays, the strength and everything has changed. So usually 25 to 30 ml we give as a test dose, and we see, when the patient is getting digestion, and after that we go for, the next day dose, the dose fixation for 7 days, everything. Okay, we do that. So basically, it should be digested in 1 yama. According to Dalhana, it is 1 pala, that is 50 ml, and basically, practically we give 25 to 30 ml. Okay, that is RCS. Then next is Acha Sneha. Okay, so basically, what is Acha Sneha? Basically, the Sneha Dravya which is given as it is. Okay, because we know Sneha Dravya can be given with the food items. Okay, Sneha Dravya can be always mixed with the Rasa Dravyas. Sneha Dravya can also be mixed with the Madhyam, all those kind of. There are various ways of giving. Okay, and even when you eat like rasam with ghee, or your dal fry with ghee, or papu rice with ghee, all those things comes under vicharana only. So here basically why they want to separate this sneha, basically here you give the sneham, okay, in a pure form. Okay, Achapayastu Tamahu Vicharnam, because it is not called Vicharna, because the pure form of Sneha Dravya is given. And here one more, the main important thing is Pradama Kalpikeha. This is Sreshta. Whenever you are planning for Snehapana, there are, many people ask, why we are not practicing much about Vicharna Sneham, Sadhya Sneham, all those things, because this word, simple, Pradama Kalpikam, they already told, this is the best. Whenever you think about Snehapana, this should come to you, because this is Pradama Kalpikam. This only will give you the best results. Okay. So because of this Pradama Kalpika in nature, whenever we think about administering Sneha Dravya, we must think about this, Achapana only. And the Achapana Kala, either for 3 days, 5 days, or 7 days. Once again, in that they told Vikalpa, if it is Kapha, that is also, see, many people, see, Ayurveda is a very vast science where, you can find answer for everything. If even for normal people, if they are not able to, if it is, they think it is Kirikiri who will do the calculation and other thing, they told, okay, if you see this more Kapha Anubandha, give Achapana for 3 days. If it is more Pitta Anubandha, give for 5 days. And if it is more Vata in nature, give for 7 days, like that. So it is one criteria to administer Snehapana. That is one simple criteria. Of course, this is not excellent criteria. You may not get the excellent result, but still, if you just want to practice, okay, it is Kapha Vyadhi, Kapha Pradhana, you can go blindly for 3 days, then Pitta for 5 days, and Vata for 7 days. So that is one criteria they have clearly told. And one more criteria simply depends upon the Kosta. Okay, in Mrudu Kosta, you give for 3 days. Later, we will see how to find out the Kosta. These are all like, day-to-day practice, practical aspect where you want to just practice it. You don't want to break your head. Then once again, after this, you can think about the Kosta. So if it is Mrudu Kosta, give for 3 days. Madhyama Kosta, give for 5 to 6 days. Or like 5 days you can take. And for Krura Kosta, give for 7 days. Simple. So these two criteria are very practical criteria, where you don't want to think too much about the dose fixation and all. Okay, where you want to, get the results and the person is okay. You don't want to go too much into difficulties. These basic 2 criteria will help you to achieve some kind of results, if not the good results. So that is about the Achapana. Okay. That is, once again, you have Shamanacha, Shodhanacha, Brahmanacha. These are the classification. Okay, we'll see later. Then we'll see in Achapana only. Next is Shamana Sneha. So basically, you see the Dravya is the same. Either you take any Gritam, Mursida Gritam, or Tailam, or any other Gritam. The Grita is the same, but how the same thing will act as Shamana Shodhana only by 2 criteria is very, very important. One is dose, and second, and it depends on the Agni, and third, if you say the kala. So you can say these are the three criteria. And those also, if it is leave, it is difficult, but depends on the Agni or depends on, the kala. When you are giving, okay, and in what time you are giving, and in relation with food, whether you are giving after food or before food. These two criteria plays a very, very important role. Okay? Okay? Kshamanaha kshudvato ananno madhyama matrascha sashyate. Kshamanaha kshudvato ananno madhyama matra. See, these are the criteria. Okay? Punar ahare nishe jirneve piben naraha. Okay? Punar ahare nishe, okay, jirneve piben naraha, that is Shodhananga. And whereas in Shamananga, Shamanaha kshudvato ananno madhyama matra. So it should be madhyama matra kshudvatam. So when you are planning to give Shamana Sneha, there should be good appetite. There should be good appetite. Rogasya Shamanartham, because it has to undergo digestion. Sarvamarga Anusari, Balya Punarnavakari, Sharira Indriya Chetasam. So it has to undergo digestion. Okay? And once, once it digests well, then only it can do this Sarvamarga Anusari, Balya and Punar, it can give strength, because Acharya clearly explains, when the person is not having good hunger, his srotasas will be covered by kapha. If the srotasas are covered by kapha, then the absorbed snehadravya cannot penetrate the srotasas. So this sarvamarga anusarni cannot happen. In bubukshita person, the person who has good appetite, the srotasas are not covered by kapha, they are opened and they are clean and clear. So once you give snehapana, that will be digested well. Once it is digested well, it is absorbed and it travels through the srotasas all over the body and it do dosha shamakam. Okay? So madhyama matra is important. Ananna, okay, is important. Basically, shudvatam. Okay? So person should have good digestion, good agni. Okay? So here, once again, you must understand what is good digestion and agni. In practical point, if you want to know, the person should say that I need to eat. Without eating, I can't do anything. I'm getting angry. I'm getting irritated. That is the excellence of agni, where the appetite, you feel like you need to go and catch some kind of food. That is the excellent agni. That is where you say, I'm really having good appetite. So that is the time, okay, you should give this Shamana Sneha, okay, basically. So next, if you see the Shodhananga Sneham, this is Prakipita Dosha, Shodhanartham Ubinjamana Sneha, okay, Shuddhyate Punar Ahare Nishi. You can see, it should be given Ahare Nishi Jirne Pipan. That means early in the morning, before appetite. That Shamana Sneha, you can give in the evening also. See this. Shamana Sneha, either you can give after morning appetite or after evening appetite also. Whereas here this is Ahare Nishi. This is very important. That is the reason why I told the Kritam may be same, but when you are giving, what quantity you are giving, that decides whether that particular Snehadravya will act as Shamana or Shodhana. So it should be given in the morning, okay? Immediately after the food is digested, the previous day taken food is digested in the morning, before developing the appetite. Okay, it should be Hestane Jirna Avane Sneha Ache Shuddhyate Bahu. Okay, Hestane Jirna Eva Anne. Okay, you can see this very important. So the person should not develop appetite here. The person should not develop appetite here. So it should be given in the morning. So these are the ideas you should have, criteria you should have. It should be given in the morning, after the digestion of previous day food, and before developing the hunger. Okay, and it should be given in Uttama Matra also. Okay, but practically Madhyama Matra is suitable. And that is one separate topic I can take, why I can justify why Madhyama Matra. Okay, later, but it's once again it's too big, so I'm not going to cover it. Okay, though it is said that Uttama Matra vai Charaka, but Madhyama Matra is always better for Shodhana Snehapana. Okay, because if you give Uttama Matra, the 24-hour digestion may not take place. Okay, the quantity will be more. Whereas if you go with Madhyama Matra calculation, the digestion can happen within 24 hours. This is a small thing I am telling you. And if you are giving Uttama Matra, then it may not be possible for us to finish in 7 days also. So practically, when you calculate that dose and everything, Madhyama Matra will be more apt. Okay, so these are all the criteria. Then only it will act as a Shodhana Sneha. Okay. Next is Hrisva Sneha, and it is always basically what you do is it is mixed with food. Okay, and basically it is given for Bala Vriddha. Okay, just for Brahmana purpose. Usually we give this one at the end of, you would have seen after the end of the chapters, they have given so many Gritam. Why? Because lastly Sneha Dravya is given, except some chapters where the Gritapana is explained, where the Shodhana is very important, like Pandu, Kushtam and other things, and psychological diseases, where the Chikisa Sutram start Pandu Ami Yadav Pibet Kalyanakam Mahakalyanakam, that is there, that because that is where some of the diseases it starts with the Gritam itself. Okay, whereas in most of the chapters the Gritam goes last, Thailam goes last, because there sometimes we don't need to do Shodhana, or we don't need to do Panchakarma, where we need to do some kind of Brahmana. That's the reason why they have given so many Gritas. So this Brahmana Grita or Brahmana Snehana happens there. Okay, and always it should be mixed with food, so it's a kind of Vicharana Sneha also, you can say, always given in a less dose. Okay, and it is given for longer duration also. Okay, Vyadi Jayet Balam Kuryat Anganam Cha Yatakramam. So it should, first you can see Yatakramam. It is very important. Sometimes we need to read the word by word sloka. Okay, Vyadi Jayet. Okay, next Balam. First it takes care of Vyadi, then Balam. Okay, Balam Kuryat Anganam, followed by Balam Kuryat Anganam Yatakramam. Okay, so slowly it takes care of the Vyadi, then it gives Bala, followed by Bala. So it is Rasayana, Balya, and everything. Okay, that is Brahmana Sneha. Okay, then next is Sadhya Sneham. So this Sadhya Sneha practically we use in some of the conditions where you basically to do a Snehapana. You don't do Snehapana like 7 days, like classical Snehapana. Okay, Sadhya means Tatskshane. Okay, Tat Kale. That's what is being told by Acharyas. Okay, Tatskshane or Tat Kale. So immediately it should give the Samyak Snigdha Lakshanas. But practically you don't get that Samyak Snigdha Lakshanas immediately and all. Sometimes what happens, we need to read in between the lines. Ayurveda glorifies so many things. Okay, just to say the importance of that. So here also Sadhya Sneha means you just, we cannot say just, just by giving morning you give Snehapana, evening you do some Shodhana like that. It's not like that. Whereas certain conditions where you need this Sadhya Sneha, okay, where immediately you have to do the dosha, Vilayana and removal of doshas. Okay, so this Sadhya Sneha you practice. Take the example in some cases of where the person cannot tolerate even 3 days of Snehapana. But usually what I practice is some of the skin diseases. Some people even 1 day they don't take Snehapana. You would have come up. So in all those people, those who Sneha Dveshi, where you want to do literally Shodhana, but they are not at all cooperating. So in those cases, somehow you can do this Sadhya Sneha mixing with salt or mixing with some other simple food items like paya, kanji and all. Ask him to somehow encourage, take him for 1 day. Okay, then next day you plan for, or that day evening itself you plan for Vamana Virachana. And some cases of Siravedam also, where you are planning for Siravada, that person is very weak and tired. where he may not have proper nutrient. Though you can give mudga, yavaha, mudga yusham and other things and mix with nice palatable kritam just for dosha utkleshana, and then you can go for some siraveda. Okay, so basically take the example, some of the bites like spider bites, or some people come with this lizard urination, that also create some kind of dushi visha in that. And some people will have this severe gastritis, basically severe gastritis symptoms. When in those cases, if you give gridam also, I've seen, though you take tiktakam gridam or dadi madi or indugandam also, the third or fourth day the gastritis symptoms increases. So in those cases where you give this sadhya snehapana like 1 day like that or 2 days like that, then you go for Vamanam or Virechana. So basically, here is, though it is said as Satya Sneha, according to Chakradatta, if you go deeply, it should be given for at least 3 days. If not, at least 1 day or 2 days. It is not that, you give and immediately you do Shodhana. It is not like that. So Chakrapani clearly explains it should be given at least for 3 days. That's what he talks about Sadhya Sneham. Though the name is told as Sadhya Sneham, according to Chakrapani, minimum this Satya Sneha should be given for 3 days. So this is the one practical point you understand. It should not be thought that, okay, 1 day you give Snehapana and you get the desired results. No. And one more thing, when you are planning for this Satya Sneha or Pravicharana Sneham, you don't observe this Samyak Snigdha Lakshanas and all. Okay, maybe little bit Sneha Dvasham they may experience. That's it. You don't see this Vadanaloman, all those kind of things also. But whereas, of course, if you give it for 2 days or 3 days, in the third day and all, some kind of little bit of, because the dose also very less in Satya Sneha. The Sneha Dravya dose also very less in Satya Sneha. So it is not like classical Snehapana. So you may get some kind of Samyak Snigdha Lakshanas, but not all the Samyak Snigdha Lakshanas. So the point is, where it is kind of emergency it is used, where I told these are all the conditions. These are all not used extensively in many diseases, but as I told before, Raktamokshana for this lizard, this one, and for this spider bite, okay, and for this gastritis symptoms, these are all the places where I have used this Snehapana, and where these people in some of the skin diseases also, where they don't want to do at all, so give like 1 or 2 days or 3 days, this Satya Sneha, especially Saindava Lavana or some Yusha, then somehow convince them to take this for 2-3 days, then go for Shodhana. So something is better than nothing. So these things helps accordingly. Okay, this is about Sadhya Sneham. Okay, then about the Pravicharana Sneha. So why this meaning? If you see, it's very Pravicharana. We think and give. Okay, because we think what kind of food item to be given to him, because you get veg people, non-veg people, then some people take mamsarasa, some people don't take, some people like this. So it depends on the likes and dislikes of the patient. You think, if you are going to Achapana, you don't need to think, only think about what grida you have to use and you just give. Whereas Sadhya Sneha or Pravicharana Sneha, if you want to give, you have to think what you want to give. Okay, what food it should be according to the dosha, everything, what food it should be mixed with. So that you always think. That's why it is called as vicharana. You think a lot, then you give. That is the reason why it is called as pravicharana. And one more thing, the V shabda means ishat matra. Always the dose is very, very less. Okay, so it is given always less in dose, ishat matra. Okay, because we always give food more, and alpa matra sneha mixed with food and given. Okay, because we use alpa matra, it is called as vicharana, and because we think and give, that is the reason why it is called as vicharana. Okay, so next is we will see a little bit about avapidana. Okay, basically avapidana means basically pressing or squeezing or suppressing. Okay, so literally avapidana snehapana means pressing down the fat. Okay, the food, either fat presses the food or food presses the fat. Okay, so here basically what it does, here the fat squeezes down the food, and after digestion of food, vata dosha suppresses down the food. Okay, simply empty stomach is vata pradhana. So it is given in empty stomach. So basically empty stomach is vata pradhana. So fat squeezes down the food, and after digestion of food, vata dosha suppresses down the food. That is the reason why it is called as avapedanam. Okay. So next comes the Uttarabhaktikam. So you can see it is given basically Uttarabhakta after the food. So it is also, once again, you can say comes under, it is a kind of Brahmana only. Okay, because Brahmana Sneha can be given before food, during food, and after food. Okay, Uttarabhaktikam. All right. So here also in Avapedakam also food is mixed with Sneha Dravya. Okay, so here also it can be act as a Brahmana, it can be, you can consider as Sneha Pravicharana also. Okay, but because its action, the name is given like that. Okay, so Uttarabhaktikam basically Bahu Shri Shagade Nasyam Panam Cha Uttarabhaktikam. So basically this Uttarabhaktika Sneha, basically, even Avapedaka I will tell where I used to practice, So Uttarabhaktika, usually this diabetic, periarthritis. This is a very common condition you come across nowadays. Diabetic periarthritis is the very common condition. If somebody, the middle-aged man or woman, they are coming to you, they are saying, I am not able to lift my hand. I'm not able to, my hand is not going behind my back, and I have constant pain, but it is a mild pain. Range of movement is restricted. The first question you ask is, are you diabetic? At least 90%, otherwise there should be injury. If there is injury, the range of movement will be restricted. Otherwise, the person will be 100% diabetes. Okay, diabetic person. So definitely if they come with that, that is the, in those cases, basically you go for Uttarabhaktika Snehapana. Fantastically, it will work. Of course, in frozen shoulder, and basically you can use it in cervical spondylosis and cervical spondylitis also. Okay, and in vertigo. Okay, vertigo, it's a very difficult condition to treat, but fantastic results you will get, in a vertigo treatment when you give the Uttarabhaktika Snehapana, because most of the time what happens, when there is an issue with cervical spondylitis or nerve compression or the joint space narrowing in the cervical canal, it does affect them. So they do get positional vertigo. Okay, in that cases also you can go for this Uttarabhaktika Snehapana. All right, fantastic results you get. All right. So in these are the cases usually I use this Uttarabhaktika Snehapana. Okay, because it's very most of the times in Shuddhavata conditions. Okay, and basically you see Vyanavata and Udanavata. So wherever the Vyana and Avarna, Vyanavrta, okay, and Udanavrta Prana and Vyanavrta Udana, in those conditions also. And in some cases I use it, but not good results. This Parkinson's, some kind of results you get, and this motor neuron disease. Okay, this amyotrophic lateral sclerosis also you can try this Uttarabhaktika Sneha. Okay, it's a form of Brahmana Sneha. Then you see now little bit practically if you want to understand, okay, how it is. So as I said, these are the criteria. So the Ghritam is same, but how they act as Brahmana, Shamana or Shodhana, these are the criteria. So first one is Matra, all right. So that is this one Charakachara told Shodhananga Snehapana Madhyama Matra. I agree completely with him. Why? Because when you give Madhyama Matra only, you get Samyak Snigdha Lakshanas. Okay, and mainly the digestion will take place within 24 hours. If not, it will take like that. If you go for Uttama Matra and all, it takes 32 hours, like 36 hours and all. So if you give Madhyam Matra, yes, it does happens within 24 hours if you are able to calculate properly. Okay. And for Shamana Atya Sneha, maybe you can go for Uttama Matra because it is given basically in the fixed dose, okay, for 7 days or even for until the the condition is reversed. Okay, because if you see even Shamana Sneha, this one they already told that Patyam Karyam Sneha Viriktavat. So that much Patya they told. Okay. So many times, though we say Shamana Sneha should be given until Vyadi, Shamata is happening, nowhere else it is mentioned like that. we actually give, until because we cannot give so much of this one. Even for Shamana Sneha also, it is given only 7 days only. There you don't see that Shamana Sneha should be given until Vyadhi is taken care of. But later we developed this. But according to the original text, it is Uttama Matra, fixed dose for 7 days. Okay, because dose to Utkleshana is not the criteria. Because if you give the fixed dose for Shodhananga, the brain will know when the digestion takes place like that, and dosha Utkleshana will never happen. That I wrote in my book. Okay. So here for Shamana Sneha also is maximum 7 days only. That is the reason why they said Patyam Karyam Sneha Virikta Vakta. What is the Patya for Sneha Virechana or Virikta Virechana Patya? What? Basically, Lagu Ahara and Pay Milepi Mandam, like that. So according to the digestion, you must choose which food should be given. Sometimes you may need to wait until the entire Snehapana dose is digested. But whereas we don't give that much amount of Shamana Sneha, but original text, if you want to go, it should be Uttama Matra only. It should minimum take 24 hours to work, and every day you should give that Uttama Matra in a fixed dose form. And after 7 days, we have to go for, basically kind of Samsarjana Karma. Then it should be taken care of. But whereas practically, what we started doing is, even here I wrote till Vyadhi Shamana. So this, we must study more about this by giving this Shamana Sneha in the fixed dose, high dose for 7 days. What is happening? We must do the research on it. Okay. Next is time of administration. Shodhana Acha, fixed time early morning. Okay. And Shamana Acha when there is a good appetite. Then Anupana depends on Sneha. Then Shamana Acha Sneha, we give Anupana depends on Roga. All right. But if you are giving a Uttama Matra, once again, you have to follow Ushna Jala method only. Then Samyak Snigdha Lakshanas, most of the Lakshanas are visible in 5th day, 7th renal Samyak Snigdha Lakshanas, whereas in Shamana Acha Sneha, because why I wrote this, nowadays we give very less amount of Samana Acham, so that's the reason why, whereas when you give Uttama Matra as for 7 days and all, you may get Samyak Snigdha Lakshana, definitely more Lakshanas also. Though we don't use because of side effects and other things, so we may get only certain Lakshanas are visible. Okay. Then post therapy followed by Shodhana. For Shamana Acha, Shodhana is not at all necessary because there Snehapana only works. Okay. Then if you can see in Pravicharana Sneha also, what is Karma Bheda? Once again, basically you give before Virechana Pravicharana Sneham for Kapha Utkleshanam. Okay. Then you give Pravicharana Sneham before Virechana for Kapha Avriddhikara. And you give Pravicharana Sneha before Basti for Angamardava and Vata Anuloma. Even before Basti or after Basti, you can give Pravicharana for Angamardava and Vata Anulomana. Okay. And you give Pravicharana Sneham before Nasyam for Dosha Vilayana. And before Rakta Mokshanam, you give Pravicharana Sneham Dosha Utkleshana. Okay. So basically, the Vicharana Sneham is, you can give here in Vasti also, as I said before Shodhana Vasti, though I have given external for Nasya. In Vasti also, you can give both internal and external, whereas for Rakta Mokshana, it is internal. Okay. So examples also I have given, you can go through it. Okay. These are the examples, depends on different karmas. Okay. Then if you see here, I made a slide where difference between Shodhanartha Acha Sneha, Pravicharana Sneha and Sadhya Sneha. So for Shodhanartha Acha, it is Kevala Sneha, and Pravicharana Sneha always mixed with food, and Sadhya Sneha, here you see Pravicharana Sneha, the quantity is less, but it is also Vadanadi Sambandham, whereas in Sadhya Sneha, the quantity is more, though it is mixed with food. This is the main difference. You must understand. This is the main difference. Okay, Pravicharana Sneha, Vadanadi Sambandham, okay, less Sneha Dravya is used. Sadhya Sneham, Vadanadi Sambandham, but more Sneha Dravya is used. Okay. Next is, if it is, okay, Bahut Shakti Iktavat, okay, Sneha se Alpotvat, okay, it is very less strengthened. Okay. And it is the Sadhya Sneha also basically very less strength, but when you compare Pravicharana, So if you want to make Shodhanartham is first, Sadhya Sneha comes second, and Pravicharana comes strength in strength wise. Okay. So Mahaviryam, Alpaviryam, and moderate Viryam. Okay. And Shodhananga Sneham, Pradama Kalpikam, and Pravicharana Sneham, alternative to Acha. Okay. Sadhya Sneham, alternative to both Acha and Pravicharana. Okay. So then once again, Shodhananga Sneham used orally, Pravicharana Sneham oral and external, and Sadhya Sneham once again oral route. Okay. Basically, here it is once again in a little bit modern anaerobic pathway, that is in case less oxygen of production of energy, which is utilized by glycogenesis and glycolysis process. Here aerobic pathway, that is direct active oxygen produced by carbohydrate metabolism, and Sadhya Sneha aerobic pathway, direct activate oxygen produced by carbohydrate and protein metabolism. So it is, I have tried to give because of the food. Okay, here you see in Sadhya Sneha little bit more protein is added, whereas in Pravicharana Sneha, okay, carbohydrate is added but less. Here it is no carbohydrate, pure fat. So glycolysis happens, okay, in Shodhananga Sneha. So now we have seen different classifications and where we give everything. Now simply we will see a SOP for any Abhyantara Snehapana. What is the SOP of Abhyantara Snehapana? Where in day-to-day practice, where you have to follow this. Okay. Basically, you must keep all the emergency medicines available. Okay. So Anupana Dravyas must be kept. And this is very important. Do proper Rukshana. Most of the cases, what I found is basically, this diabetes mellitus, okay, basically, any kind of kapha anubandha disorders, okay, obesity, polycystic ovaries, okay, wherever you feel, this particularly any condition where the hormones, where, the lifestyle diseases are involved, definitely do Rukshana. That's what Acharya has also told to us. And in most of the cases, even if you feel slight ama is there, slight kapha anubandha is there, please follow proper Rukshana. So I have always, nowadays, most of the time, I started doing this. The results are really encouraging actually. So basically, Ruksha Purva, proper Rukshana therapy before Snehana therapy is very, very important. In most of the cases, for Rukshana therapy followed by Sneha therapy is highly beneficial. You can practice that. All other necessary blood tests should be, because literally you can show them before after treatments. The lipids goes down, LDL goes down, triglycerides goes down, definitely. So they will feel fantastic with that. So go for lipid profile, okay, and blood sugar before, after, during, everything, okay, which is very, very important, okay. And make sure that patient doesn't develop appetite before Shodhananga Snehapana. This may look simple, but this is very, very important because we already saw in our texts, it is very important not to develop the appetite. So make sure the patient doesn't develop appetite before Shodhananga Snehapana. Okay. And definitely somehow continue the procedure until Samyak Snigdha Lakshanas are observed. Then only you get excellent results. Okay. And sometimes what happens when you give some of the Sneha Dravyas, like, Sukumaram Gratam, where there is, Eranda Thailam is there. So it can mimic that Samyak Snigdha Lakshanas. Okay. But be careful. You have to, in that case, you have to evaluate other Samyak Snigdha Lakshanas also, not only, Adastat Sneha Darshanam, because easily loose stools and other stats Sneha Darshanam can happen in that day itself when you give Sukumaram Gradam, but that alone is not Samyak Snigdha Lakshana. So please continue the Snehapana until you get the Samyak Snigdha Lakshanas. Okay. Definitely take detailed history, surgery, everything. Okay, vitals every day. Ask for dairy allergy. Of course, Gridam mostly will not cause dairy allergies, but some people are allergic to milk products. Okay, so in that case, try to give only 1 drop or 2 drop of ghritam, or safely go for thailam if the person is having dairy allergy. In India also, because of the casein and A1 cow, all those kind of things, the dairy allergy is becoming more and more. So be careful about the dairy allergy. Always ask this question. Okay, and basically then for swastha person, so this is once again very big argument is going on, that I will next slides I will tell. For I practice for swastha person, or if cleansing is a part of seasonal routine, then pure cow's ghee can be used. Okay, whereas in other conditions I always go with the samskarita ghritam only. Okay, so, and this is my observation, the medicated ghee gives better results than pure cow's ghee. Okay, and one more thing, scientifically speaking, I'm not agreeing with that, but still, patients do ask, intake of too much saturated fat. Okay, pure ghee is more saturated fat, whereas when you do it with the process, with that also they have beautifully explained. New researchers have showed that when you process the ghritam with our medications, the pure saturation goes down. Okay, so the saturated fat goes down in samskarita ghritam. Okay, so that is the reason why always better is samskaram. Okay, so and samskaro gunantaradhanam. Okay, because it changes some of the internal constituents of ghee. So I always prefer to give samskarita ghritam. This is my observation, and there are so many vaidyas, even in Karnataka, most of the places they do give simple ghritam. But you see, there also they give murchita taila, murchita ghritam. Once again, that is samskara only, na. So the question simply don't arise whether we need to give samskarita or asamskarita. There, if you do taila murchana, it is samskaram only. Okay, so basically it is samskaritam ghritam only we must give for the better results. Okay, and if it is for swastha purpose or this periodical shodhana like vasna vamana and all, you can go for pure cow's ghee. Okay, then advice to the patient, many patients don't nowadays. Even I said watching too much mobile or TV also should not be, or people hear too much songs, putting inside the AirPod and all. Okay, all those things, always tell to patient this, Kushnodopaka Upakarisya Brahmachari Kshapashaya and Ashtaud Mahadoshakara Bhavas definitely must be taken care of. There, people say in some of the places I found that if you give Snehapana, they don't even allow them to go outside the room. No, nowadays don't do that. People will feel fed up. Okay, so if the climate is moderate, if there is not much windy, if it is okay, then you can allow them to go for a small walks and all. That will help for them to digest well. Okay, and ask them not to use AC and all, whereas this is what I practically see, like people say, sir, can I go for a walk? And especially when you are going for weight loss people, obesity people, definitely you do one thing, like if they are going for some kind of walk and all, of course the strenuous things should not be excessive. Uchair Bhashanam Radakshobam, they said anything excessive only they told. They never told that, it is, that's how we misunderstand our concepts. Okay. Oh, don't expose to even the funny thing is, you see the translation also. Oh, don't expose to, breeze. How it is even possible? Don't expose to breeze. Everywhere the breeze is, they should write that too much of exposure. Okay. Nivada sthanam means, they say, can it possible Nivada sthanam? Tell me, you stay inside the room where there is no vata. This is how the translation is. Is it even possible? Right. So we must understand anything excessive should not be done. That's it. So excessive, exercise, excessive thinking, all those things, anything excessive should not be done, but normal things can be done always. Okay. That you should always tell, because nowadays people prefer that. Okay. Then basically, food wise, before, during, or after bhojya annam matraya. Okay, dravam anabhishandina sankiranam, they told. So simple food. So here also you understand one thing. People get bored if you keep giving only kanji to them. They have told so many various vikalpas. So what I do in my practice, I give different soups, prepare different soups. Okay, simple soups, vegetable soups, okay, spinach soups. It's very watery only, na? So give different soups, usions you give. Okay, every day, the idea, especially the diseases where you are trying to treat madhumeham, this PCOS or thyroid or even obesity, you try to cut the complete carbs. Then only the ketosis can set and they can get the desired results. So basically, in those cases, you go for Yusham, more protein, or if they are taking for non-veg, you can give even Mamsarasam. Who told we should give only kanji? This is what everybody follows, we also follow. Okay, if they like, if the person is Muslim, or if they like, the appetite is good, give this paya, no? Give this Mamsarasa. What is the problem in it? Acharyas clearly told, to take care of the increased vata. All right. So even after Shodhana, all those practices should be brought in, and definitely different vegetable soups we can give, different soups we can give, different yushas we can give, so that the person will not be get bored. That is the reason why third day, fourth day and all, they will stop eating kanji, because we as a human, our evolution, we don't, every day we eat different things. Why? Because that's how it is created. Right. So make it more palatable to the patient. So he will be happy to continue the Snehapana. And I have seen, because of this kanji alone, many people want to quit Snehapana. Sir, please. So, try to bring these kind of small things into that, into their thing. And you see, easily you will sail through the food part and as well as the Snehapana part. Okay. Then, you should have drugs also. Snehapana may cause complications like Agnimandya, Arochakam, Shulam, Brahmam, Parisekam. So you have to have drugs according to the condition. You can always. And one more thing, what happens during this Snehapana, sometimes people may develop constipation. I have seen it. Okay. Though we give Ghritam Snehadravya, sometimes they can be constipative. Okay, take the example Dadimadi Girda. I have seen it. Okay, in such cases, because constipation should not happen. Okay, either you mix with next day you mix with Sugumaram Ghritam if you want to purely, or you can go for some Triphala or Anuloma, because Vada Anuloma is very, very important. Nowhere else it is told that medicine should not be given during Snehapana. Of course, until the digestion of that Snehapana, we should not give anything. But once it is digested, we are giving food like that. We can give the medicine also. Very, very important. So, if the person is developing, basically, the Vata Anulomna is not happening, you can go for mild laxative like Triphala, which is always beneficial. Okay, which is always beneficial. So these are all the different medicines you can always give. So if you have during Snehapana, so this you may come across. Okay, so this you may come across. So once the digestion is over, okay, these medications you can always give it to the patient, because I told you nowhere else it is mentioned it should not be given. I told you it works. The Snehapana works by Matra and Kala, okay, nothing more is working there. Okay, so because practically you see this, you need to keep that patient, right? Especially, if you are in the government sector, okay, if that patient goes also, no problem, you can get. But in a private sector, you have to tackle all these practical things. If the person is having Shula, you have to take care of him, right? You cannot say, okay, no, you are under Snehapana, we won't do anything, right? Even local application should be given. So these things, should be taken. Of course, not during the digestion of Sneha. Once it is digested, during digestion of Sneha, take the example. If during the digestion of Snehapana, somebody got her periods, of course, from next day you want to stop, you will stop it. But that time you have that girl is having severe pain. What you will do? You have to do like local Svedana or hot water bag or some external lepamanda. So these and all nowhere else prevented. So we have to use our yukti so that we can be a successful practitioners. Okay. So these are the different medicines you all know can be used. Okay. So here, now I will say about simply how to access the koshta. So basically, in classics, they have told about how to assess the koshta. This is a practical method I made, which is very, very easy. Okay. So you can, it is like a grading system. It is like how you give marks. So you give this questionnaire to the patient himself. You don't need to think about much about Costa. You give this questionnaire to patient himself, ask him to tick. Lastly, you see what is the score. You will come to know what is his Costa. So it is simply to understand the Costa. These are the things. So how you Krura Costa? Basically, sometimes he will pass the stools after straining. So 4 questions are there. Regular bowel movements will not be there. He will pass once in 2 or 3 days. Hardly water content will be seen in the stools. So this is the 4 criteria for Krura Costa. Then Madhyama Costa, if you see that person, if you ask the questions, there will be solid banana stools, maximum once daily. No strain or bit strain is necessary to pass stools. If this person is having this, then you can say he is having Madhyama Costa. Then Mridu Costa person, most of the days they will have bowel movements twice daily, most of the days. Rarely they will have solid banana stools. Okay, there will be, the stools will not be like banana stools. Okay, rarely they will have. They don't need to strain, and immediately when they get up in the morning, first they do is they'll go to the toilet. They say they don't need to drink coffee, tea, nothing. They immediately go to the toilet. Okay, so basically, if you see bowel frequency in 24 hours, so 0 bowel movement, you give score 1. If he goes once per day, you give score 2. If he goes twice per day, the score is 3. This is the bowel frequency. Then consistency. Hard pellet-like stools give 1. Soft, well-formed banana stools 2. And watery stools with indigested food particle, it is 3. Then comes the urgency. No urgency, won't have an urge in morning. Sits long time to eliminate with discomfort. The score is 1. Moderate urgency, which can be controlled but happens in the morning, but not necessary to sit long, you give 2. Then marked urgency that cannot be controlled, goes to the toilet immediately getting up from the bed in the morning, then you give the urgency score 3. Okay, then this Trivrit Lehem you don't need to. Okay, influence of food and beverages on stool. When depends, people eat differently different foods. Okay, so food, if it food influences them frequently, then it is 1. Occasionally only the food influences their bowel movement, then the score is 2. Then food doesn't, food makes him to go to toilet like 2-3 times, then it is 3. So overall assessment, if the score is between 1 to 5, it is Krura Costa. If the score is between 6 to 10, it is indicated Madhyama Costa. And score 11 to 15 implies Mridu Costa. Okay, this is what it is. You make it. Okay, all right. So you give this one to patient himself. Accordingly, you will understand the Costa. Okay. Then Sneha Matra Anartha Veva. So without understanding the Agni, if you are trying to give Sneha or Snehapana, which is Anartham, which is useless. Okay, that is the reason why assessment of Agni is very, very important. It is very important to fix the dose of Sneha. Okay, because Mandagni and Atyagni is always contraindicated. Proper Agni is very important. Then only the indication happens. Okay, and if you know the Agni and Costa, then only, especially Agni, you will fix the dose. Okay. So basically, if you see, this is thanks to Dr. Vasant Patil sir, and you all know about how to assess the Agni and how to give the next dose fix. Okay. Prior to first day of Snehapana, test dose into time taken for digestion and given dose. This and all I want to quit. You know this. Okay. And this Agni Bala index also, and accordingly, when you do this, you will know this one. So basically, if you see, in a person 30 ml of Snehana, this is how to fixing the dose. In a person 30 ml of Snehana digestion 3 hours on first day, then Agni Bala index is 30 by 30, that is 3 equal to 3. That is in the same person 30 ml digestion 6 hours. Okay. So Agni Bala index is 30 divided by 30 into 6, so 0.6. So in the first day, Agni Bala index is 3, which is reduced to, because usually the Agni Bala index reduces when the second day, third day it goes. Okay, that should increase. Sorry, that should reduce. The Agni Bala index should go down. Then only that means the Agni properly functioning and the Sneha Dravya is properly digested. Okay, so this is very, very important. Lesser the Agni Bala index, more will be the Agni Deepti. Okay. And before Sneha Dravya, Deepana Pachana is very, very important. Deepana Pachana Dravyas are, okay, very, very important. All right. You see this. You can see, simply I gave 2 examples. Ingvachadi Churnam works on Ama. It is more Vatanam Lamla, works on duodenum and intestinal level. Ashtachurna Agnivardhaka, not Vatanam Lumna, works on stomach level. So it depends on the condition, for Agnivardhana, whether you want to go for Inguvachadi or Ashtachurna. With these 2 simple criterias, you can choose either Inguvachadi or Ashtachurna. Okay. Same is with the Chitrakadivati and Lashanadivati also. Chitrakadivati directly works on Agni, whereas Lashanadi works on Ama. Okay. So basically, when we come to the Pradhana Karma, dose fixation, okay, first and foremost is Manasopachara. So mental counseling is very, very important to the patient. You must, many of the Indian doctors, what they do, they don't explain the treatment modality to the patient. We must make the patient sit and explain, this is what we are going to do, this is the outcome, these are the side effects you may expect, but please encourage the patient to undergo this procedure. Especially this Snehapana and Shodhana procedure is very, very important, because this is, very difficult procedures to undergo. That is the reason why you must explain this. Okay. Then accordingly, Rishiyasi Matra I told 25 to 30 ml you give. Then you see when it is digested, then accordingly the dose fixation is done. Okay. So basically, most of the places, they go with maximum 300 ml and all. They start with like 25 ml or 30 ml, then they go keep doubling it. Okay, this is general practice. 30, 60, 90, 120, 160, until 300 they go, then they stop. And within that also you get some kind of Samyak Snigdha Lakshanas, it is fine. But if you do according to the Agni Bala index, according to the Koshta, definitely it can go up to 600 to 100 and 200 ml. Okay. I have usually given to patients, okay, until 800 ml, when especially the foreign patients, because they take whatever you give. So in one case, I have given even 120 ml. Only one time in my life, I have given 120 ml. Most of the time, like 450, 500 ml, it stops. Sometimes 300 ml only it stops, because either you get some Snigdha Lakshanas or the patient cooperation, does not happens. Okay. So basically 3 days, 5 days, I already told. Okay. Now dose calculation. So Dwabhyam. So first day, this is the criteria you keep very simply. You will understand, you will fix the dose. So first day, it should digest in 1 hour. Second day, if it is Mridu Koshta, it should digest in 3 hours. Third day, it should digest in 6 hours. So when you use that calculation of Agni Bala index, easily you can calculate the final day dose. Okay. But Mridu Koshta, the Uttama Matra, okay, or sorry, the Madhyam Matra, the excellent dose, it should digest in 3rd day, because Mridu Koshta Sniheti in 3 days, right? So that is 6 hours is the maximum. He will get, the digestion of Sneha Dravya takes place in the 3rd day. Then you can give him the food. Okay, this is for Mridu Koshta. Okay, and in Madhyama Koshtam, so first day it should digest in 3 hours. Second day, it should digest in 6 hours. Third day, it should digest in 8 hours. Then fourth day, it should digest in 10 hours. Then fifth day, it should digest in 12 hours, because Madhyama Koshta, okay, it takes 12 hours to digest. And in the final day. So Madhyama Koshta, it is 5 days. Then if you see, the Uttama Koshta, the Krura Koshta, because the Sneha Dravya will take 24 hours. Okay. It takes digest. Okay, so the dose should be accordingly. So first day you should digest in 3 hours. Like that, in the 7th day, the entire dose must be digested in 24 hours. Okay. So some of the observations, these are the practical observations I have seen. Generally from third day onwards, there will be Agni Deepti. Okay. Koshta Snigdhata is seen before Tvak Snigdhata. Okay. Then we can assess Koshta Snigdhata by Sneha Darshana in stool. This can be understood by asking the patient whether he felt oiliness in the hand while washing after defecation. This is one criteria, practical criteria you can always ask. Okay. If he says, then it is Koshta Snigdhata. In some cases, for the first 2 days, the patient won't pass stools. Okay. So basically, I told Anulomana Dravyas must be given. So for all complications, Shunti Dhanika Jala itself is more than sufficient. It takes care of it. If not, you can go for some medicines also. Okay. And before Snehapana, a thorough Rukshana is necessary for better results. Okay. And practically, high doses can be given in 2 divided doses with half an hour to 1 hour gap. This I practice. So if it is high, they cannot drink. So ask the patient, or you can give even like 3 doses. Nowadays, even Kashayam I practice like that. Okay. So ask the patient to take little. Okay, you wait, make up your mind. Maybe you drink Shunti Dhanya Jalam or Bhavana Shunti, you choose. Then you take 1 more dose. Then after like 15-20 minutes, 1 more dose, like that. So like divide the dose and give, then it is easy for the patient to take. Okay. Then this is one calculation, Snehapana in Krura Koshta. This is the rough calculation I made. Like that, I already told, the idea, Agni Bala index and everything. Don't think dose fixation is big deal. You follow this criteria. It is very, very simple. Take the example. Here says you gave 30 ml. Suppose it digested in 2 hours. So quantity per hour is 15 ml. So for next day is it should digest in 6 hours. Okay. So 6 it should, because we told in Murdu Koshta it is 3 days, right? So next day it should digest in 6 hours. Or Krura Koshta it is 24 hours in the 7th day. So 15 into 6, that is 90 ml is the next day. See how very simple it is. So 90 ml. Suppose it took 5 hours to digest. So then quantity per hour is 18 ml. So next day it should take 8 hours to digest, right? So 18 into 8, 144 ml. So this is the dose calculation. But as I said, this is maximum. If it is originally given, even for Krura Koshta person, definitely, as I told, it should be minimum 600 to 1200 is the dose. I know if you are originally practicing according to the acharyas, this is the dose. You will get perfect Samyak Snigdha Lakshanas and everything. But trust me, even in my practice, it is very, very difficult. Okay. And but in some of the psoriasis and all those skin diseases and all, as I said, somehow you make like ask the patient to take it twice or thrice or something, but let her take. This high dose is very, very important for giving the excellent results. Somehow encourage to make it at least in the last day. Let them take minimum of 600 ml at least. Okay. Then only the desired results will come. Otherwise, most of the time that acts as like Shamana Sneha only. Okay. So this already I told. Okay. Detailed history I told. Okay. Here, not to use cold water and other things, natural algae, all those things. Okay. Then this is also very important. Ask the patient to eat food only after having proper appetite. Many times the false hunger comes. Okay, they say within you would have understood it. You would have, sometimes people say you would have come across it. After immediately 1 hour, 2 hours, they say, sir, I feel like having a kasif barta ide, sir, ota ista ide. You don't need to. Okay, so tell him to wait until, how you can use this criteria here, belching. There won't be any belching, and when they're belching, the smell of ghee should not be there. That means, okay, you are ready to give the food. If not, please don't give the food. Though they say they are having hungry, ask them to drink enough water, or maybe you can give, simple watery, peya. Sorry, mandam you can give, or vilepi virladram, watery, some starch water you can give. That's it. Because if he is diabetes person, if he is having, giddiness and all, starch water, rice water, you can always give. Okay. So this I have given. Okay. So these are all the, Brahmana, Pravala, Panchamrita I have given. So these are all the medicine commonly used. Later I'm going to now say what are the different, my clinical experience also. Okay. Basically, you see, when you want to give Tiktakam, Mahatiktakam, simple example I will give you. So if it is Asti Sandhigata Vatam, along with psoriasis, go for Google Tiktakam Gratam, or osteoporosis along with some skin diseases, Google Tiktakam Gratam you go. Then Mahatiktaka Gratam, when you compare Tiktakam, Mahatiktakam is Rasayana in nature. So where you want to give, more, where there is no Kapha and Bandha, it is more Pitta, and where you give more Rasayana, give Mahatiktakam Gratam. Okay. So in Avarna Vatam, you go with Sukumaram and and PCOS, another thing you give Sukumaram. In the Parkinson's and this paralysis cases, you go with Kshirapala Thailam. Dhanvantaram Thailam, you go for paralysis cases, but if it is not a new case, if it is recent one, Kshirapala Thailam. If it is a little bit more chronic and where it is due to the mild hemorrhagic stroke, where more Pitta Anubandha is there, then Dhanvantaram Thailam is more than sufficient. Then Kalyanakam, you use it for any kind of psychiatric disorders. Okay, especially Unmada condition. Okay, and Apasmara condition. Okay, you can use Pramigritam and Saraswata Gritam for delayed milestones. Okay, and in autism you can use. Okay, you see these are the Vidaryadi Gritam once again for Vatam, Dhanvantaram Gritam and Trikandagadi Gritam for basically you can use it for diabetes mellitus. Okay, and Vastiamayantam Gritam you can use it for benign prostate hypertrophy and infertility cases. Phalasarpis, female infertility cases as well as male infertility cases. Dadimadi Gritam you can use it for duodenitis, okay, and gastritis and IBS symptoms. Okay, then Shatavari Gritam, once again you can use it for if there is uterine fibroid, if there is cases of what do you say, this Asrikdaramanda. Okay, so Vajrakam Gritam, where you can use it Vata Kapha Pradhana Kushta, whereas Tiktakam Mahatiktakam Mandal Vata Pitta Pradhana Kushta. Okay, Mahatiktakam more Rasayana also. Okay, so basically this I told. Shamana purpose when it is hungry, Shodhana purpose when it is food taken. Okay, these are the Panakalina Lakshana. Okay, definitely you will come across Hrilasam, Chardi and Aruchi. Okay, so to overcome is you can give this lime juice, liquid mandam, hot water, Bhavana Shunti. So these very important, these three things you have give. And snehane jirnam kim kartavyam, you know that hot water bath, hot water drink, and shunti dhanyaka jalam. Okay, and these are all the Jiremana Lakshana and Jire Lakshana you get. Okay, and basically, okay, when you go through is this. Okay, this is very, very important. I want you to see this. Okay, how you will understand whether the Samyak Snigdha Lakshana is observed. So I have made the criteria here. Okay, so Vadanalomnam, Gatra Mardam, Anga Asamhata Varchas, okay, and Gatra Lagav. Then you give the score pattern. You see here Vadanalomnam, how you see the scoring pattern. So belching and burping with the smell of Snehadravya frequently, along with the heaviness of the abdomen, no evacuation or evacuation of hard stool. That means the score you should give 1. Second, belching and burping with the smell of Snehadravya occasionally and no heaviness of the abdomen. Evacuation of faces once with flatus. However, heaviness of abdomen is present. That means patient is not satisfied with the evacuation. Then you can give score 2. Then 3 is no belching and burping, no smell of Snehadravya, proper evacuation of Vata, Mutra and Purisha. Patient is completely satisfied with the evacuation. So if this criteria satisfies, then Vatanalomnam is 3. Okay, then Gatra Lagam and Gathok Snigdatam. If the patient, if you touch dry normal skin, no change in skin texture. Second, soft skin but without oiliness. Third is soft skin, and you see the shininess. Oiliness, how you see some kind of shininess will be there. Soft, oily and shiny skin you will see. Okay, and Asamhata Varchas, first person will have normal banana stools maybe once daily. During Snehapana, all these things happens, okay? Then semi-solid stools, maybe twice daily. Loose stools more than 2 times a day, okay? Then Snigdha Varchas, for number 1, you give loose stools with no fat. Then 2, you give loose stools with fat but no fat in closet water. Third is watery stools with good amount of fat and Snehadravya floating on the closet water. Okay, then it is 3. Then Gatra Lagom, feeling heavy after taking fat and feeling discomfort is 1. Feeling heavy after taking fat but comfortable. Feeling light and comfortable is 3. Okay, then Sneha Udvesham, if number 1 you give, there is no aversion. Second one, minimum aversion, but sight of fat causing nausea. Third, can't withstand even the sight of fat. Okay, the score pattern is 1 to 13, Avara Samyak Snigdha Lakshana, 14 to 17, Madhyama Samyak Snigdha Lakshana, and 17 to 21, Pravara Samyak Snigdha Lakshana. So, the Samyak Snigdha Lakshanas also, whether you got Avara Samyak Snigdha Lakshana or Madhyama or Pravara, with this scoring pattern, with this I have developed, with this you can easily come across, you can easily understand whether it is Uttama or Madhyama or Avara Samyak Snigdha Lakshanas. Okay, diet after Snehapana, you know, I already explained different diets you give, okay, different soups you give, so that he won't feel aversion. Okay, so clinical evaluation. So for Shodhana Snehapana, oily stool and appearance of ghee in the closet before defecation and loose oily stools. Okay, this alone you can say you have achieved clinically Samyak Snigdha Lakshana. Blindly. For Shamana Sneha, aversion towards fatty substance. You keep giving, but he says, doctor, I can't take it anymore. Okay, then that criteria you can take it for Shamana Sneha. Okay. And Chira Utpanna Vyapat, accordingly, you know, you take care of it. Okay, just to show I have given this. Okay, then our Avapedaka Sneha I already told. Okay, and basically it is given in Mudra. See, this is very, very important. We always say Avapedaka Sneha is given in Mudra Vega Roja Janya Vikaras. Okay, but if you see the texts, a careful observation of the text from various acharyas can throw some light into it about Avapedaka Snehapana indications. So this form of Snehapana can be indicated in all Adogata Vata Roga, that is Apana Vaigunyam. They say in Apana Vaigunya, it is not only related to Mutra Roga Vegas, but all Apana Vaigunya. Okay, it can be given in all Apana Vata Rogas. Very, very important. And because if you go through the Mutra Vega Adhyaya, what are all the symptoms they said? They have said Mutra Vada Rogas includes Adho Vada Rogas. It is not only says the symptoms of Mutra Vegadharana. It are no Vegadharana symptoms and Shakrut Vegadharana symptoms also. So basically, we should give this Avapedana Snehana. Basically, we should give for Mutra Roga Vegadharanam, Shakrut Vegadharanam, okay, and this Adhovada Vegadharana. In all these conditions, you should give. So, and practically, diseases related to thighs, lower back, and kidney. So practically, piles I practice, okay. Then BPH, Vasti Amayanta Kardam, usually I give, and BPH I give, and infertility. These are all the 3 things I practice in today, okay. So you can see Avapedaka Snehapana also indicated in Raktarshas. Many times we don't practice this. It gives pelvic inflammatory diseases. In female pelvic inflammatory diseases also, and female infertility, because Apana Vaigunya is there. Okay. And according to Kashyapa, it is indicated in Shukra Roga also. It is indicated in Shukra Roga also. Okay. So infertility, BPH, arthrorogam, ulcerative colitis, IBS, Crohn's disease, in all these diseases, you can apply this. Okay. And here, Ghritam is preferred as Sneha Dravya because Thailam is Baddha Vitkam. Already, we are using it for, Apana Vaigunyam. In Apana Vaigunyam, already the Apana is, is going upward. We have to make it go down. Okay. So, Thaila can already cause Baddha Vitkam. So it will not create Vata Anulomana or Mutra Anulomana or Shakrut Anulomana. That is the reason why ghee is given. Okay, and also Thailam is Alpa Mutra Pravartakam. Whereas Mutra Rodham, we have to make the Mutra to Pravartana. Reasons why Ghritam is used. Okay, then this is the simple procedure. Jirnantikam cha uttamaya matraya yojanadvayam. So basically, yojanadvayam means interpreted in two ways. So first, Ghritam is given, medicated Ghritam in the low dose, Hrisvamatra, followed by after some time when the patient is relaxed after exhausting the ghee drinking, light food. So until mild digestion happened, okay, mild, appetite is developed, then immediately light food, okay, mandam or yusham. Once the food and Ghritam both is digested, given food is digested well, okay, what you do is, again, Ghritam should be given in Uttama Matram. So this is one. Hrisvamatra, food is digested, then Uttama Matra is given. Then in the second method, first Uttama Matra is given, followed by Alpa food, and once again food is digested, again Uttama Matra. Here Alpa Matra is not at all coming into the picture. Both Uttama Matra, mild food followed by Uttama Matra. Okay, basically, but this first one is mostly accepted by everybody, and the second one is because both Uttama Matra, it create difficult. Okay, here Dalhana, according to Dalhana, in Mutra Vikaras and Nabhi Vikaras, he says either depends on the condition. Uttama or Hrisva is given, then followed by Uttama Matra. But basically, at the end, one main criteria here is at the end, it should be Uttama Matra. The starting can be Hrisva or Uttama. Okay? Whereas end should be Uttama only. This is very important criteria. But basically, because of practical difficulties, we start with, Hrisva Matra only, then end with the Uttama Matra. Okay. So basically, where to give, despite of giving all the treatments, if the bleeding is not stopping, okay, the avapirna should be given. So even this we can be practiced in post-surgical cases also. Okay. So this I have given to my Shalya people to take up. So in some of the cases, I'm going to, where the bleeding is not stopping, without any other medications, we are going to start only this avapedaka. Okay. So here, this is how particularly they have given. So Hrisvamatra ghee is mixed with Koshna Mamsa, administered, and after digestion, once again lukewarm ghee is given. Okay. So here avapedana sneha acts as Brahmana. So here they are giving with asking us to give it with Mamsa Rasa. But we can, if Mamsa is not, by people, those who can't take Mamsa, we can give Mudga Yusham, then, once it is digested, okay, then we can give the Uttama Matra. This is particularly told in Rakta, piles, bleeding piles, okay. When to administer, once again, it is kind of Shamana Sneha only, Kshudvato Ananno. Okay, when it is hungry, morning, either in the form of Uttama Matra or Hrisva Matra only. Okay, so it is always, because there is clearly they have not mentioned when to give. Okay, so we should think it as a Shamana Sneham, though we are adding food to it, but not mixed with food after that only. So basically, we should give it in the morning hours. Okay, when there is not much appetite. Okay, so how many days? Maximum, once again, take our book, leaf out of the book. Okay, once again, 7 days can be given, and basically 50 ml can be given as a prakbaktam. Then after the digestion of food, once again, maximum you can give 100 to 250 ml, depends on the patient. Okay, but basically 50, then maximum you give 100 or 125 practically. That's what I do. That's a maximum dose. Otherwise they vomit. If you give 200 ml, 250 ml and all, they vomit. So stick with 100 or 150 ml. Okay. Then once again, a little bit about, we spoke about Sadhya Sneham. We will skip about, this. We already know Sadhya Sneham and practice and all, duration, then once again, Vicharana is there. Okay, now we will see one little topic here. Reason for including Kevala Sneha in Vicharana. Okay, this simply I want to say here. Though Vicharana refers to mixing with other entities, okay, like food items and everything, Kevala Sneha is used in various external procedures like Abhyangam. This question everybody would have asked, right? Like Abhyangam, Tarpana and others. There is no specific reason for considering Kevala Sneha as Vicharana Sneha. Kevala Sneha and Vicharana Sneha are differentiated based on the Sneha Upayoga, mode of administration. Okay, the quantity of Sneha and whether the Sneha is combined with dietary substances. Okay, so mode of administration in Kevala Upayoga, Sneha administered orally without mixing with food or drugs is considered as Acha Sneham, that is Kevala Upayoga. Okay, in B is Bahu Upayoga. Okay, Sneha administered through various routes. Example, Vasti, Nasya, Abhyanga is referred as Vicharana Sneha. Okay, here the main reason could be the Alpatvat, Alpa quantity. Okay, Akshitarpana and all, very small quantity is used, not like and there is one more thing Chakrapani Acharya explained why Abhyanga Mandal not included under Acha Sneha. Clearly he says there is no Agni Sambandham. All these procedures like, Kavalam, Gandura, Gandusham, okay, why this, because this question is Kevala Sneha must come under Acha Sneha, why it comes under Vicharana, he told. This Agni Akshitarpanam, Vasti, Kavalam, Gandusham, direct Agni Samiba is not happening. Contacting with Agni is not happening with these things. That is the reason why they are included under Vichara Sneha, not under Acha Sneha. Chakrapani clearly explains. And second, here all these oil and other things are used in very less quantity. That is whereas in Achapana the quantity is very more. That is the reason why though we use Kevala Sneha in these procedures, they are included under Vicharana. Okay. Then here along with Snehapana, what are the modernized things we will see this. So basically nowadays I started practicing one thing. I don't know how many of you will accept or how many of you will not accept. Nowadays one positive thing is you get these capsules, Grita capsules, Thaila capsules. So the people, those who are not able to, modern problems needs modern solutions, right? So people take the example, psoriasis patient is there. We need to take care of, somehow the vitiated dosha. So I started administering in a capsule form. So I start with one capsule contains 5 ml, right? So if you want to give 25 ml, give like 5 capsules or 7 capsules in the first day. Okay. Then next day you make it like 10 or 12. If it last day and all, if it is 30 capsules or 50 capsules and all, okay. So what I do is I make it like 15, 15, 15. Ask the patient to slowly swallow in 1 hour. Okay. In 1 hour, then the patient swallow. What are the side effects I have noticed is they feel full really. Okay, they feel really full actually. And sometimes when you compare to the normal ghee drinking, they are feeling nausea and vomiting, but the throwing up, they completely vomiting is very, very rare in it. Okay, I really don't know, because it is a gelatinous substance, how far it is going to create trouble. I really don't know about it. We need studies for that. But Samyak Snigdha Lakshanas are happening properly. Okay, and patient compliance is very, very good in that. So I started practicing this, nowadays, the Snehapana in the capsule form, I started giving. Okay, this is one point. Okay, so basically, nowadays, we need to have some kind of evidence-based, treatments and evidence-based explanation to people. Okay, so basically SOP, that's what I told. Standardization is very, very important. Okay, though we say, depends on the costum and Agni, but some kind of standardization, All India Institute and all developing, Santosh sir also know, we are also developing. So standardization for Madhyama Kosta, Krura Kosta, and we can always depends on the Gritam. We can do the standardization, which is very important. So when you do the standardization, but imagine when we do the standardization, what is the fun of treatment, right? Simply you will become like that. Any machine can do that, right? You put in the computer, you give, everywhere. I am against of standardization of everything. Sometimes human brain has to work. Sometimes our intuitions must work. Otherwise, it won't be more fun. You will not do some research. Your mind will not work. Simply, we become like what is the innovation happens. But those things can be helpful for people, those who don't want to put much mind into that. Though standardization is important, but I still prefer the our own intuition and our own calculation method. Okay, so but if you want to take the Ayurveda to further, the standardization is very, very important. Okay, and when properly legal and ethical requirements. Okay, when we follow the safety norms, when we follow the things properly, when we give the treatments without much side effects, we are legally protected. Okay, so that also very important. And communication with patients. So evidence-based, as I told you, explanation to the patient is very, very important. Outcome of the treatment is very, very important. What you are going to do, what medicine. Sometimes we don't even feel good if they ask what I'm taking, why I'm taking, why it is given. We should have patients to explain them. We should say this medicine works like this. Everything we have to make it happen. Okay, so then only the acceptance will be more, and we have to at least explain to them how it works, why it is going to be helpful to him. So that encouragement will help the patient to give accept our system and do our treatments very, very properly. Okay, the next is evidence-based approach. Okay, so we say, as I told, we have to do the blood work before after treatment. In my hospital I started doing it before after treatment, all the blood works. So show to the patient evidence. See, take the pictures, take the videographs, show to the patient. You see, this is how it was. Now it is. This is how it is. Okay. So blood work, it was like this. Your C-reactive protein was before like this. Now it is like this. Your sugar was like this. So evidence-based approach is very, very important. To show to the patient. Okay. So basically, we do lots of nowadays randomized controlled trials and clinical trials and everything. Okay. We have to evaluate particularly either Snehapana, because Snehapana alone we don't do. We do Virechana, Vamana and everything. Okay. And particularly comparative studies with placebo. Okay. And RCTs must be done. So, so that we can give more evidence. Okay. So basically recent series, you see like quality of life is improved. Okay. And after structured Panchakarma programs, but we need to take it further, because in PG studies and PhD studies, we are not taking RCTs because we fear, we always think that what will happen if my medicine won't work. Trust me, it will work. So placebo group should be included, then only we can give the proper explanation. RCTs are very, very important. Okay. Then standardization of the procedures. Okay, like how many hours Abhyangam should be done, what is the time duration, like as I said, like entire standardization. Okay, the time period of, say, take the example Shodhana Sneha, this is the exact time you are going to give, like 6:30 to 7:30. Accordingly, you give the food item to the patient so that he will not get problem, whereas food will be digested. Okay, so all the treatment procedure standardization along with safety is very, very important. Okay, because that's what I'm talking here. As I said, though I don't like so much of like standard thing, like like SOP and all, but there are two types of people, right? So some people want everything like standard and they don't want to put much mind into that. So for them, it is very important for us to develop this. And not only that, this will prevent about Atiyoga, okay, Ayoga, the treatment is not working. So at least they can go through this standardization procedure, and at least they can make their life out of it. That is the reason why we need the standardization procedures. Okay, so protocol standardization includes the protocol, dosage, medications, indications, contraindications, chronicity of the disease, okay, and procedure and protocols, defining step-by-step guidance for each therapy. I gave you the SOP like that for each therapy. Okay, Purva Karma, Pradhana Karma, Paschat Karma, all those standardization must be given. And technological advancement, okay, basically technological advancement we must develop. See, take the example, how to check the Gatra Mardam or Tok Snigdhata. So basically we need to develop something where you take the sebum, okay, and oiliness test. Okay, we can do, develop any kind of patch or any kind of instrument where we can, before Snehapana, what is the oiliness is there in that particular skin or particular sebum. Then after Snehapana in the 3rd day, 5th day and 7th day, we can check, the oil content. When you see that if it is increased, then you can say, okay, Gatra Mardam, Tok Snigdhata and other things, okay, and thickness of the skin. Once again, to check the Gatra Mardam, we can develop some kind of mechanism where the softness of the skin can be skin texture under the microscope. What is the softness level before and after scoring? All those things we can always develop. Then it can be more standardization. Okay, it will help people to use that modalities, all those instruments to check it. Okay, then we can use this. Okay, body fluids during Snehapana. Okay, changes in the body fluids after Snehana. Okay, and the fluid studies you can check in the normal blood, and this protein studies you can make. Okay, then thermometer, all those things we have always used, to check the heat and all. So with this method, if the pitta predominant person, the heat can be less, and we can say the heat only this much, reduce the heat like that. Okay. And basically you can see Svedana Yantra, you can set there nowadays, Bashpa Svedana and all, you can sweat, you can check, you can set the proper heat, everything, and even like hot water bath. Nowadays, all those things are there. So you can always use like that automated Vamana, Virechana, okay, suction mechanism, dosage control, and OLED display. Yeah, these are all the things we are developing. Okay, clotting time, running the Raktamokshan. These are all the new things we have to, okay. So what are the changes? Okay, basically take the example in the Snehapana. Metabolic syndrome. We don't think about when we give Snehapana about this metabolic syndrome. Okay, hyperlipidemia, fatty liver. Okay, pre-existing cardiovascular risk factors. Okay, as administering escalating doses of pure lipids like Vardhamana Snehana can cause anxiety regarding temporary spike in blood cholesterol and triglycerides, necessitating strict pre-treatment lipid screening and dietary management. Okay, that's why I said, if we give processed ghritam, this doesn't happen, and always we can tell to the patient it works, and always we should be careful in between, we need to check this. Okay, and strict dietary and behavioral compliances. Okay, so definitely during Snehapana and all, the diet plays a very, very important role, and as I said, Ashtavadmas, Mahadosha, Babas and other things should be taught to patient, and it should be kept properly. Okay, so this is the clinical experience. Okay, basically this is the Udara Shulam. As I said, Snehapana alone cannot be given. It will be given along with the other medicines, other treatment only. So here I gave this Palaserpis. Okay, Udara Shula patient. Okay, like abdominal region, sore belching 4 years. Okay, you can see this is Snehapana chart. Okay, so this is one thing. Okay, and the results already, these are all the we got the complete results, and because the time is very less, I thought I will only share, because Dr. Santosh told me to share my clinical experience. These are all my clinical experience. Okay, then second patient, Sandigata Vata. As I said, Sandigata Vata, okay, Asti Shausharyam will be there, Asti Kshayam will be there. Already, Tiktakam is already told with the Kshira, okay, because the Karatva increases there, because already Karatvam decreases in this Asti Shausharyam, Asti Shosham. So Google Tikta Gritam, because of the Tikta and Google, the Karatvam increases. Okay, so in the Gandham Gritam, it's an immunomodulator. So I mixed this and I gave, okay, for Sandigata Vata. Okay, this is the one. very good results, and I do have photographs and other things. We do take videos and photographs, okay, how it is. Then next is Kati Shulam. Once again, here I have chosen this Google Tiktakam Gritam, okay. Then once again, Kushtam along with Sandigata Vatam, okay. It is a kind of psoriasis patient, okay. Then here you see I gave the Brahmi Grita. Many of us think that Kushtam means always. Brahmi is excellent Tikta Dravya. You go through the Brahmi, this one, we think Brahmi means only psychological. Very good result in this case, okay. I remember about this case. I only gave Brahmi Grita here, okay. Then Indralupta. Okay, excellent result for Indralupta Mandal. Of course, we do Prachanna in our day-to-day practice and OPD practice, but please do Snehapana followed by Prachanna. Okay, so this is what we gave. Okay, you see the results here. Okay, and Mahatiktakam Gridam I have used. Okay, so these are the results we got actually. Okay, then Gridrasi once again. Okay. Basically Google Tiktak Gritam, okay, we have given, okay, Staulyam, okay. So here I want to, when it comes to Trifala Gritam, we give. When it comes to Staulyam, I have a new thing I follow here. I give Snehapana for 3 days, Uttama Matra, followed by Virechana, again 3 days Snehapana, followed by Virechana. Like that, I will give like 12 to 15 days. It is nowhere mentioned in any texts. And I have seen, I have done a placebo trial also. I have done a classical Snehapana also. Trust me, the amount of weight they lose, and the same thing I do it for, this diabetes mellitus. The amount of weight they lose is in this 15 days will be 6 to 7 kilograms. I can write and give, either Trifala Gritam or Mahatikta Gritam or Murchida Tilatailam I use. Okay. Definitely 6 to 7 kilograms in 15 days they lose. The idea is very simple behind this. You make the person to come into ketosis mode. LCHF diet pattern, high fat, low carb diet. This is the idea. Along with that, you give Virechana, and night time also I go for Nitya Virechana. Okay. So it works more on kidneys. Lots of water loss happens. Ketosis mode sets in. Okay. Basically, the fatty acids and glycerols, the adipose tissue is disintegrated. The person lose weight. Okay. So this is how I treat the metabolic syndrome, or I treat people, those who have very increased weight and diabetes mellitus. Okay. Then Pushparani Dushtavarna. Okay. So basically, as I said, in Dushtavarna, most of the time, okay, you do, simple one, but definitely you must do Snehapana also. Okay. Here also, Brahmigridam I used. Okay. Then Francis is like varicose ulcer along with Kushtam. Okay. Then Mahatiktaka Gridam mixed with Brahmigridam I used. Okay. This is the thing. Then once again, Katigragam, Spondraj. Okay. Here I Google Tiktakam along with Vastyamintakam I used. Okay. Then Pakshagada case, definitely you have to use, Pakshagada case also. Okay. You must use Snehapana. Here I have used because Majja, Mastulanga Majja brain. So I used Majjagata Vatam as Google Tiktakam Gridam. Okay. Here, this is once again here also Google Tiktakam Gridam. So these are all some practically I, use day-to-day life Snehapana. And with this, I conclude my presentation. Hope, you got some kind of idea, because it's completely about Abhyantara Snehapana. I made in a simple presentation way, combining all the different Snehapana, Abhyantara Snehapana methods and some of the inputs with my practice also. Thank you. I thank the HOD, Sir, Dr. Santosh Adali, sir, Mante Sugar, sir, okay, and Dr. Rajesh, and all other staff and the entire department of Panchakarma. And I sincerely thank Principal sir also, Tarnath Medical, Ayurveda Medical College, Bellary, and PG students for patience hearing. Thank you. If you have any questions, you can ask me. Thank you.
Thank you very much, sir, for such an insightful, informative, and thought provoking lecture. Your lucid explanation of the classical principles of Abhyantara Sneha, along with its relevance in modern clinical practice, has definitely enriched our understanding. Now, we shall move on to the question and answer session. I'll read out the questions for you, sir. First question is, what is the practical experience regarding the appropriate dose, timing, type of ahara, Samyak Snigdha Lakshanas, and maximum duration of Uttara Bhaktika Snehapana in clinical practice?
So as I explained, I use Uttara Bhaktika Snehapana basically, Apabahukam case, okay, then this diabetic periarthritis, okay. All this sneha, understand, I do it for 7 days. First thing, how many days? It is 7 days. Okay, it is 7 days. Basically, I go with either Maharaj Prasarani Tailam or Mahamasha Tailam. Okay, in a Taila form only, I give Uttara Bhaktika. So, very light diet. Okay, usually I go with Yusham or even our Kichari, with our simple Kichari where less rice, more yellow moong dal is given. So, nice Kichari with cumin, seasoned with cumin and black pepper, tadka dene ke baad, okay. Light food in the morning only, okay. Then after the food is digested, okay, I give this snehana, okay. Like the quantity wise, basically, this is not Arohana Snehapana. So basically, I give in between 30 ml to 50 ml. Okay, if the person is okay, digestible, he is feeling better, he is feeling good, if he see strong, I will ask him. First day itself, we can know. Can you take little bit more dose? So next day, I increase it to 50 ml. So maximum, I go with 50 ml only. Okay, so this is the two conditions, and this is how I practiced Uttara Bhaktika Snehapana.
Thank you, sir. Next
And
question
7
is,
days. Maximum is 7 days.
okay, sir. Thank you. Next question is, Achapeya means even not doing Murchana. What is the rationale of having opinion of Madhyama and Uttama Matra for Shamana and Shodhananga Sneha Matra?
Achapana means?
Even not doing Murchana is the question, sir. And what is the rationale?
Even not doing Murchana.
Yes, sir.
Okay. See, here this question, you must understand, Acha means Kevala. Okay. Here, when you go through the text, Kevala means Asahayam. Okay. Kevala means Asahayam. Anyadrabir Samyuktam. Asamskaritam. Okay. These are the, basic things told by Dalhana. Second, according to, Adamalla, the commentary, Kevalam iti, Kevalam Paitige, Payam, Gritam, when it comes to the context of Gritam, Kevalam Paitike, Payam, Vatike, Lavanan Vidam, they told. Here, Kevalam, he says, Pittahara Dravei Saditam Eva, Ityartaha. Here, Kevala means don't give Kevala. Pittahara Dravya Sadita Gritam only you should give. So, Vadike Lavana Kafa Lavana Trikatu with Trikatu. Vadike Lavana Vidam Kafam one more the Trikatu. So, you can see there is, the Snehapana Vidhi itself, it is told Pittahara Dravya Sadita Gritam. Then if you are giving it for Vata, it should be mixed with, and Lavanam. Then for Vyosha Trikatu, Vyosham and Trikatu should be mixed for Kapha, this one. So here we must understand, even if it is in Jwara Chikitsa also it is told, in Gritapana, they said, like in Pittaja Jwara, Tiktadreva Sadita Gritameva. Okay? Tikta Grita Swadita Gritameve, they have told. Alright. So basically, it is though the references are scattered, okay, it is written there. Basically, you must give processed only. And Dalhanas, you can commentary, you can clearly you can go through it. I have written in my book also. Okay. Samkshepam, okay, prakshepam should not be happening. You should not do any prakshep dravyas, whereas the processing, samskara, okay, samskara can be done always. So that is the reason why I told, okay, samskarita ghritam is always better. Okay, otherwise, why should they say all the samskarita ghritas at the end of the chapter? Though we may argue they told it for Shamana Sneha, they told it for only, Brahmana Artham, like that. But, this, taking out all these references, and practically also the person can see and do the Snehapana. It is basically you do in a patient and see. You give pure Ghritam and the Samskarita Ghritam, you will see the difference in the results. And not only that, I told you, always pure Ghritam is literally a saturated fat. And take out one more thing, like, what is the cholesterol levels of when you give the pure Ghritam. And you see Samskarita Ghritam, see what are the cholesterol level. Because this I have done in Asamskrita Ghritam, and if you see the Google also, somebody did this study. In Asamskrita Ghritam, the cholesterol levels, the LDL and the triglycerides are going up, whereas in Samskarita Ghritam, it is going down, whereas only slight increase is there. Because of all these things only, the Samskarita Ghritam is always used. Okay?
Okay, sir. Thank you, sir. Next question is Pravicharana Snehapana is considered as alternative to Acha Snehapana before to Shodhana. If considered, what is the rationale for selecting the dose of the Sneha, Arohana Krama, and quantity of Pravicharana Sneha?
See, Pravicharana Sneha, they never told us Arohana Krama at all. Okay, Pravicharana Sneha, you can mainly use it as for Shamana or Brahmana purpose. Okay, for Arohana Karma, this is my opinion. Achapana only should be given, because by giving Pravicharana Sneha, you are not going to get any kind of Samyak Snigdha Lakshanas. It can be used as a Sadhya Sneha for 1 or 2 days. Okay, that time you can mix little bit the next day or third day, because Sadhya Sneha again once again given for only 3 days only. Okay, not more than that. To get Samyak, to get the Sneha Karma Ashu Sadhana, they told. But as I told many times in Ayurveda, it is like they give alternatives, and they give prasamsha. Whereas in the practically when you do, that cannot happen. So this Pravicharana Sneha mostly used as a temporary measure, and where the person is not at all cooperating, in that cases you use Pravicharana Sneha. Okay, no problem. Even you can use it as 7 days. You can every day you can increase the dose, but you will not get the desired effect. All right, because Alpa Matra, there you are going to use only Alpa Matra Sneha. Okay, so the desired effect will not be there at all. So it is a kind of compromised effect, but something is good for nothing concept here. So we use that. That's it.
Okay, sir. Thank you. What is the standard practical method for calculating the dose in Avapidaka Snehapana, sir?
See, standard method, once again, as I told, depends on the Agni only. But basically, we go with Halpa Matra. So 50 ml, 30 to 50 ml is the base dose. It's a standard dose. You don't need to go more than that.
Okay, sir. Next question is, why Dhanvantara Taila in later stage? Why not in early stage? As there is Avrutta initially, later it becomes Kevalavata.
Yeah, Dhanvantaram is more Brahmana. Right? And more Pitta Kara, more Brahmana. Initially, when it is, when it is become more this one, there will be Pitta Avrta, and there will be more, when you compare to, the Kshirapala, Dhanvantaram is more Brahmana. Because of the ingredients and other things you see, and the indication also you see, it is more Brahmana in nature.
Okay, sir. Thank you. Next question is, during Shodhanartha Snehapana, when the patient's clinical symptoms subside before evidence of Dhatu Dosha Utkleshana is observed, how can the physician assess whether the adequate Dosha Utkleshana has occurred? Does this indicate a Shamananga effect rather than a Shodhananga effect?
That is the thing. If you give the proper dose and proper time, And this main criteria is Samyak Snigdha Lakshana. If Samyak Snigdha Lakshana didn't happen, dosha utkleshana didn't happen. That's it. So you have to restart it. So when you give proper dose, proper time, and after considering the proper Agni, definitely before 7th day or 7th day, you will get Samyak Snigdha Lakshanas. Once you get the Samyak Snigdha Lakshana, that is the criteria of dosha utkleshana. That's it.
Okay, sir. Thank you. When to choose Murchita Sneha and medicated Sneha for Shodhana Snehapana?
I told Murchita Sneham, if you want, you can give for Swastha person, like you are planning to do for Vasana Vamanam or, Virechana during Sharad Rudu, or for Swastha person, you can give Murchita Thailam, okay? Or even for obesity person or even diabetes person. All other persons, I give, the medicated Gritam only.
Thank you, sir. Sir, could you share any practical experience about Vasa and Majja Snehapana?
Good question. See, Vasa and Majja, I give it as a Vasti only. Okay. Because it's too smelly. Okay. It is too smell, and by usually Varaga Vasa I give it as a Vasti only. Whereas, basically in 3 conditions I'm planning to give. Maybe next time I can share. These 3 conditions I'm planning to give. One is Parkinsonism. One is severe pain. Okay, because if you see the Vasa and Majja indication, in very severe pain they have told. Okay, severe pain when there is Ati Shula. Okay, they have told. And more pure Vata, because it's they're all more heavy in nature, so more prominent nature. So I'm planning to do in neurological condition like motor neuron disease and Parkinson's. Okay, and the excessive Shula, if it is there, back pain or knee pain, maybe I'm planning to give it with the milk and all. But as of now, I use it in Parkinson disease as a Matra Vasti.
Thank you, sir. The next question is, in a male patient, 22 years old, admitted in our hospital, diagnosed with Dadru Kushta, during and by the end of Snehapana with Murchita Grita, the itching is reduced and the skin lesions decrease instead of increasing due to dosha utkleshana. How could be the probable reason for this clinical response, sir?
See, dosha utkleshana means, this is what the basics we must go and understand. Dosha utkleshana is not like symptomatic. Understand this. Here the symptom has reduced means it don't think that it is dosha shamana. What is utkleshana? Utkleshana prasekam. Imagine like masru. You have that dadi manda is there now. Something like that. So utkleshana symptom is like where the you cannot say that okay, the dadru kushta, when you are giving, the person is not getting oozing, the person is not getting itching and all. Okay, so basically even when you are see the Shodhana Phalam also, subside of doshas, right? What is Shodhana Phalam? Right, so here also same. The dosha utkleshana means the inherent qualities of the dosha vitiation is increased. So indirectly that can subside the symptom only. So dosha utkleshana, you see, like as I said, Samyak Snigdha Lakshana, where you get this Gatra Mardam or loose stools, all those kind of things. And second, always whenever you are giving these kind of Murchita Thailam or any kind of processed, there some kind of dosha shamana will always takes place. That's for sure. Maybe here if you are given the Gritam, plain Gritam or plain Thailam, the person would have explained, may not have this subsidiary of symptoms. It would not have increased definitely, but the symptoms may not have reduced. But what is chikitsa? To remove the pain. So the pain thing is when you give like this, if the symptoms are improving even during Snehapana, that is good only, na? And just by the symptom increasing, or don't literally think dosha utkleshana as increase of symptom or increase of that particular condition. No, So please go and read how the dosha utkleshana is explained. So it is like increase of doshas, not the symptoms. Increase of doshas, and your idea is to bring those doshas. One more thing, when the doshas are reducing in that particular skin lesion, because you are doing dosha utkleshana and bringing them to koshta, right? So they are ready to come to koshta from that place. So automatically there that dosha shamana will happen only, na? Because you are helping the doshas to get softened, and they are about to come to koshta. When they are about to come to koshta, definitely the symptom will get reduced only, na? This is what happening there. Hope I am correct. HODs are also can interfere and tell in this. This is a good question, but what I gave is, I think, correct answer. Hopefully.
Yes, sir. Thank you, sir. Next question is, can Anuvasana Vasti replace oral Snehapana in the Purva Karma of Shodhana?
No.
Justify your answer with clinical experience.
No. That's why it comes under Pravicharana. Simple.
Okay, sir.
There is
Next
no
question
Agni
is,
Sambandha. Agni Sambandha should be there if you want to have, dosha Shodhana.
okay, sir. Next question is, how does Abhyantara Snehapana influence gut-brain axis?
Oh, that's a big question. It does. It does, because it completely changes the intestinal flora. And this is, once again, this is what all we have to prove. We have to, anybody, you have a PG college, study at least 30-40 people, go for a biopsy, okay, see the gut before and after. Definitely there will be good bacterial growth will be there, the bad bacterials will be reduced, okay. So we have to go for biopsy, colon biopsy with any modern doctor, okay. This really we can study this, and we can bring out beautifully that how it is changing the blood flora there. And gut brain axis, everybody knows how important it is. Nowadays people are talking more about this. Usually now you see about people who don't know, people might be knowing about this GLP-1 drugs, how people are losing weight. That is taken, that medicine works on large intestine and small intestine, and glucagon like peptide, it is reducing and people are losing weight, okay. So it is nothing to do with appetite, it is nothing to do with, so people are concentrating more on this gut brain axis. And recently also they developed one product where they are improving the gut brain, the good bacteria, so that to reduce the Parkinson's symptoms, okay. So definitely we have to go for the biopsy of it, okay, before Snehapana and after Snehapana. We can clearly explain and we can give it to the scientific world that how beautifully it changes the flora. That is the reason why when you use Snehapana in IBS or Crohn's disease and all, people don't go, the bleeding stops, the diarrhea stops, the digestion improves, the food particles which are not digested before are getting digested well. You see all these symptoms when you treat this Crohn's disease or ulcerative colitis.
Okay, so thank you. Next question is, rationality for selection of dose according to Shushruta. For example, the Sneha digested in 6 hours is indicated for Brahmanartha Vrusha. How many days it should be given, and to get result, what is the dose of Sneha?
See, basically, I don't have much idea about this Sushruta's things because I never follow. Second, as I said, whatever it is, whether it is Shamana or Brahmana or, for Shodhana, maximum they told is 7 days only. Right? When you go through the text, they never told until Vyadi is reversed. Nowhere else they told like that. You go through any text, any type of Snehana, maximum is 7 days. That's what they told. Okay, but we interpret that, this is only for Arohana Snehapana. They have given only for show. Did they give this Sneha? They give it under Acha Sneha only, right? Achapana should be given 3 days, 5 days, or 7 days. Of course, Brahmana, it is mixed with food, so you can give, that is exception. When it comes to Shamana and Shodhana, they have that comes under Acha Sneha. Acha Sneha maximum day, how much it is? 7 days only, na? Because we are not giving uttama matra and all, we are giving very less, so we consider that okay, until vyadi is subsided, we will give like that. But originally in the text it is given only 7 days only. Whereas when it comes to brahmana, it can be given, because it is with the food, it can be given for more number of days. Okay, that is understandable. So as far as this one concerned, like the dose fixation goes like in the 24 hours only. So Sushruta has given clearly a little bit more detailed explanation of in 6 hours, 8 hours and all. I don't have much idea about it.
Yes, sir. Thank you, sir. Next question is, how much gap you give in practice between two Snehapana procedures to restart the procedure? Does Deepana Pachana needed again?
Of course, it is still told, no? After 15 days of Virechana, if it is Vamana is given, it is clearly told in Siddhisthana, na? Okay? Snehapana, Samsarjana Karma. Okay? Then Snehapana, Virechana, Samsarjana Karma. Okay? Then once again, gap. Then you should start. So basically, you calculate 7 days of Snehapana, then 3 days Visrama, 2 days Visrama Kala, then 1 day of Virechana. So it is like 10 days. Then again Samsarjana Krama for 7 days. Okay, 17 days. Then again after that, one Paksha, that is 15 days. Then only the Snehapana must be started. Some people after this Samsarjana Krama itself, they do start, they don't go with that one Paksha also. But I always consider after these many days, we have to wait for one more Paksha, then start.
Okay, so thank you. Last question. As per the classics, for Shodhananga, Madhyama Matra should be given, that is, which will digest around 12 hours. This should be daily dose given as per the Agni. How can we rationalize the different dose you have explained in hours every day? For example, 6 hours, 10 hours, etc.
Yeah, Madhyama Matra, basically, you don't think it should be in 12 hours. You calculate it for 24 hours. Then only, the quantity will be correctly given, or quantity will be adjusted to the patient. Okay. If you go as a Bhagbata's Uttama Matra, what will happen? The dose, it will not, whatever the last day given dose, it will not digest even in 24 hours. That is the reason why I told Madhyama Matra should be kept, okay? And here you should understand the Madhyama Matra which so the 7th day it will be digested in 24 hours.
Thank you so much, sir. Now I hand over the mic to Dr. Vijay Mahadesh Huga, sir, for vote of thanks.
Namaste, one and all. Good evening. On behalf of Department of Panchakarma, Tarnath Government Ayurveda Medical College, Bellary, I express my heartfelt gratitude to our esteemed speaker, Dr. Chandramouleshwaran P, for his inspiring and valuable time and delivering speech, and inspiring and enlightening lecturer. Your own knowledge, practical insights, and passionate to dedication towards Ayurveda have made today's session truly memorable. Thank you so much, Dr. Chandramouleshwaran, sir. I extend my sincere gratitude to our respected principal, Dr. Janki V.S. Madam, for her constant encouragement and support in promoting academic excellence. My heartfelt thanks to our respected HOD, Dr. Santosh Edderly, for his guidance and motivation for organizing this valuable webinar series as a part of Suvarna Sambrama celebration. I also thank our respected faculty members for their encouragement and support. I also thank to all participants and faculty members for continuous encouragement and support. A special thanks to all PG scholars, UG students, Ayurveda practitioners, and every participant who have joined today's session with the enthusiasm and made this program a grand success. Finally, I thank everyone who worked behind the screen to ensure the smooth conduct of today's webinar series. Thank you, one and all. Thank you so much for your time. Namaste.
Thank you. Thank you again. Thank you all. Good night.